Hello everybody, my name is Mona Chiso Ejiogo. So today I'm gonna make my clinical video um on one of the clinical encounters I had this week. So I'm just gonna talk about a 61-year-old lady. So this lady came into our clinic because she had a history of depression. So she came in for medication management, and one of the reasons she came in was that because she was being resistant to her antidepressant medication. So she was like a kind of resistant to a lot of medication that has been tested. So she came in for medication management. So to me, so it's opened my eyes to the fact that as a psych nurse practitioner, a future psych nurse practitioner, I'm just gonna be exposed to a lot of complexities in psych and mental health. For instance, this was my first time of seeing a patient with resistant depression. Not being responsive to medications. Also, during this scenario, but during the course of seeing this patient, I developed rapport because the patient felt frustrated. The patient felt like things were not working out fine. You can imagine somebody that is depressed, no medication has been working. So I kind of developed rapport between me and this client. This made me to gain confidence. This made me to gain trust from the patient. Patient was able to confide in me. Patient was able to tell me one or two things that helped me in my planning. It helped me in putting down some plans for her, sorry. Also, during this course, during this situation, during the course of seeing this patient, I understand the relevance of being empathic as a psych nurse practitioner, trying to put myself in the shoes of this patient, trying to turn the world around, trying to see, what if I was the one that was resistant to depression? You can imagine how miserable I was. So during that course of, seeing this client, I used empathy. I also, use active listening to make sure I understand what the patient was telling me, to make sure, to validate the patient's feeling. Actually, I validated the patient feeling that whatever he or she was feeling was right and okay to feel them, because sometimes patients need that support from the healthcare providers. They need that validation, to carry on. They need that to sometimes those validations can even be like a source of healing. They can be like a source of treatment to patients. So this made me to understand that sometimes I need to validate the feeling of my patient. I need to be very empathic during the course of looking after for my patient. Also, this encounter made me to understand the importance of therapeutic use of self. During that period of time, during the period I was with this patient, I was kind enough. I was like, I was using active listening skill to pay attention, to pay details to what the patient was telling me. Also, during this encounter, I tried to let the patient know that we could try, in as much as we are trying new medications, we have to try other non-pharmacological management methods. They could also be helpful in helpful during these depressive modes. So we talked about starting new hobbies, having new hobbies that could help to elevate moods, importance of having good social network, good interaction with people, which could also help, to elevate the moods and, make someone to be happy, at least, finding someone to talk to when the moods are low. Thank you very much. Thank you.